Hello, my name is James Berry. My wife and I had a friend who had a red light from Dr. Brian McLaren, and that was the only thing that she was able to get to work to fix her horse. So we decided that we were going to save up our money and buy a red light when we got the chance to do it too. Since that time, we got a red light, but we didn't know how to use it. Then we found Eva. She was able to show us quite a bit of things, and then I ended up taking courses and eventually became an Equine Advanced Photonic Therapy Practitioner. Since that time, I've had to deal with many different problems. We had lameness, hoof problems, stomach problems, sacroiliac problems, and the worst of all, colics. The last couple of years, I've had help with about 15 horses each year with colic problems. Colics are just a terrible thing. They're breathing almost like panting. They've got cramps, and you can see their legs shaking. Sometimes their eyes glaze over because they're not getting enough oxygen. And with Advanced Photonic Therapy, you can do the colic points and standard points, and then you can also give them more oxygen so that they can start snapping out of it. Within a few minutes, you can see that their breathing starts slowing down, that their cramps are getting less. They're able to just within a few minutes completely change. I had a horse that had lameness in both front legs, so the ladies, they were scared that they were going to have to put their horse down, so I did the front legs. Within 4 hours or so, the horse was switching back and forth its weight on the legs and starting to move around a little bit, and after 4 days it was almost back to normal again. And there was another horse that went down the same day, and she had the vet there, and 3 weeks later the horse was still having problems with its leg. So I asked her if she wanted me to do the Advanced Photonic Therapy with her horse. So we did it, and within 2 days it was almost back to normal again. I have some farriers that were there, and they had to give their injection because the horse wasn't standing still. And after a certain amount of time, the horse started coming out of it. So I did some calming points, put it back into where it was sleeping again so that it wasn't having the problems. Sometimes the vets can't make it. They're on emergency calls, and it's nice to be able to take the Advanced Photonic Therapy torch and light the horse to take away some of their pain and buy a little bit of time until the vet gets there. And what's good about it is we can work together in order to get the horses back to the way they're supposed to be. I used to be a dog handler, and as you're baiting the dogs, they shake your arms. And one of the things is you end up getting shoulder problems after years. And I could only move my shoulder back about that far, back a little bit. And after doing the Advanced Photonic Therapy on my shoulder, it took me about 3 months, but now I can move my arm all the way back around like normal again. I used to work outside with the horses, and when I wake up at 6 o'clock in the morning, I would have a cold. I couldn't even breathe through my nose. So I would do some points, and by 1 o'clock it would be about 60% free, and by evening it was pretty much gone, but it would come back. So I did it for about 3 or 4 days, and then after that it was completely gone. But since then, I've learned from Eva that I should do it when I know it's going to be cold, or as a preventive measure. But even better yet, if you do the standard points every 2 days, your immune system is so high that you don't even catch a cold. I would like to thank Eva and Dr. Brian McLaren for all their time and effort and energy, and for the information that they gave me, because now you never find me without a red light. Thank you, Eva.